Go ahead,
And
Victoria. I can't do
it's my
everything.
turn. Okay. I'm a little in brain fog this morning. Sure, yes. Everything
Who
Shirley
are
said
you?
and then some. Well, my work is about investigating the issues that people have with tongue-tied airway problems, occlusion, neck pain, head pain, circulation issues, especially neurology circulation issues, what I think is going to be a big problem, and it already is. And investigating those issues so that people like Shirley's can fix them. Um, Most people don't even know they have an issue. They just tolerate their problem. So we investigate why it's there and what needs to be changed so that they can have a higher quality of lifestyle. And we also help them prevent certain types of, um, I would say, health issues in the future that they don't want to have, like dementia, Parkinson's, Alzheimer's, um, any kind of cancers or tumors. And you might say, well, how can that happen? Well, if there's no circulation and there's nothing going on in the body to dominate the area and fix it itself internally, the body will break down. And so, with Shirley's technique and my technique combined, we can catch early warning signs of issues in the body and teach others how to do it. I think the most important thing is teaching others how to investigate early warning indicators, right, Shirley?
I agree with that. We need, how do I even want to start this? So what I did a couple of weeks ago is I went to a chiropractic meeting
Mm-hmm.
and in California with Dr. Neil and EEL, and I don't know how to say the last name. It's an Indian last name, which if I have time, I'll put his name on the little chyron below here. And he had a little video, like an introductory video that we were supposed to watch the day before. And on it, he was talking about a kaleidoscope of care. And I thought, holy moly, that's exactly right. We need a kaleidoscope of care. I used to call it like a twisted balloon where you would squeeze this part and another part would come out. And so that's kind of frustrating or whack-a-mole. You hit this part and then another mole pops up and you hit that one and you just never get any kind of harmony. And the idea of a kaleidoscope gives an opportunity for us to imagine thermography, dental hygiene, myofunctional therapy, dentistry, chiropractic, NUCA chiropractic, endocrinology, naturopathy, or however you pronounce it, and all these different disciplines working together to make a beautiful image. And so that's kind of the driving idea, even behind upstream intelligence, is that all of these different components need to go upstream and figure out what happened. Why are these problems occurring? And more often than we ever know, it's either a neurological thing that happened because of a traumatic birth experience. Wink, wink, there are no non traumatic birth experiences. And the idea that the tongue did not separate from the floor of the mouth at gestational age of 12 weeks. So those are completely important features to all of this. And today, I think we're going to focus a little bit on the idea of a dental hygienist component as a separate issue or a separate business from the dental business. For me, I've always had this weird opinion that even though we work in the shared domain, we both work in the mouth, dental hygienists and the whole dental hygiene department in a dental office is there to prevent dentistry from happening. And there's a very big conflict of interest right there because dentistry makes its money by failed dental hygiene. And even though dental hygienists are taught that we are the prevention people in the dental practice, we can't practice the kind of prevention that we would like to. I got in various levels of trouble trying to even just bring a xylitol protocol into a dental practice or start doing blood sampling for my patients that had periodontal disease, because even in the 1990s, I was exploring the idea of diabetics and how that translates into the mouth as periodontal infections. And you cannot clear up a periodontal infection in a patient who has undiagnosed diabetes, but it's out of our scope. La 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 la. So there you go.
Well, it's interesting that you make those comments, Shirley, because same thing happened with me as far as wanting to develop a business within a business.
Right.
And I know with all of my
And
heart,
the
and
pushback.
yeah, there's a lot of pushback, but the business model's broken. It's like, don't sell cars because they might break down. Well, I don't care. You're always going to have a car that's going to break down because of how the person's driving it. So why not sell cars, or why not have a maintenance with the cars? I mean, it's ludicrous, but the
Yeah.
same is with the body. The body's going to break down. Things happen, accidents happen, relationships get broken, environments change, jobs stress. I mean, people are always going to have to need a prevention area along with selling the new car or the new cosmetic or one thing that dentists I see over and over is they don't have an identity that integrates with medical. Their identity has always been taken out of the body and put on another place, and has the patient, I would say, has a really bad chance of any kind of health quality care, because now you've taken something out of the body that's like, a piece of the body, and said it doesn't belong in the body. So we're just going to do the man. It's like taking the motor out of the car and saying, we don't need the car. We'll just work on the motor. And
Yes.
what
Yes.
and it's frustrating because dental hygienists, as a profession, we're trained to look for areas that are not working in right together parts, not necessarily to not get a car driving, but to help it's a partnership. And one of the things I haven't seen yet in dentistry is the lack of partnershiping with a dental hygiene department and ownership. That hygienist has no protection. What happened to me when I was working after 25 years, where was my protection? And after my investment with the dental office, growing their business, growing his business, I was stuck. And I had no alternative way of helping the business keep growing and maybe slide out of taking dental x-rays, which was the cause of my health issues from radiation poisoning, and not having that protection. So I look at this and I think to myself, the business model's broken. It's not right. And insurance companies are dictating this business model. That's wrong too. So, in the end, who gets the worst treatment is the patient. And the next ladder up would be the dental hygiene department and the dental hygienist involved in this business model. We've invested how many thousands of hours in dollars into our education? Then we go into an environment where we can't use it.
Yeah.
You know that as well as I do. When we go to our
And we have a
association meeting,
license, right?
yeah.
We have a license to protect,
Mm-hmm.
and we get lumped in with the girls, usually girls who are doing the dental assisting, where
Mm-hmm.
they have zero need for protection at all. They can practice, they can help the doctor. They're supposed to do what the doctor says. The doctor can tell them to do illegal things, and they just do them because they don't know. And then the hygienist who's there, risking her license and her livelihood, watching illegal activities going on between the dentist and the dental assistant. Sorry to open another door, but that's exactly what you're saying. It's the model is kaput. We need to have a better relationship with all of medicine, for one, and we need to have um, a better arrangement with our dental offices. Some doctors, some dentists are very just about dental hygienists, and they make too much money. And well, if you let them do what they're allowed to do based on the education, which is run by the American Dental Association, if we have to learn all of this stuff, you need to let us use all of this stuff.
How many
So,
times have I done an internal, an external, an extra, and intra palpation on a patient?
yep,
And they say, what are you doing? I've never had this done, or look for cancer, or even check circulation in the carotid arteries. I I said, well, it was on my boards. I had to learn it. It was part of my national and state boards.
yep.
And they go, well, I've never had this kind. This is great. They love it because I'm going the extra mile to take the step to look at
You're not
their
even
whole.
going the extra mile, Victoria. You're going the mile. Everybody else is taking a shortcut because
Yeah,
it's
that's true,
never
Shirley.
even asked about. The
Yeah.
doctor never comes in and says, did you check her carotid pulse? No, that never happens.
Hey,
Did you find any precancerous oral lesions? That never happens. They just come
remember
in and they just
remember
start
when we used
jabbering
to
about
check
their
blood pressure?
vacation.
Yeah, remember when we used to check blood
Oh,
pressure?
yeah. And the statistics don't bear it out. Statistically, every dental practice should have one patient at least per week that would require a normal dental practice, one or two hygienists, one dentist working 40 hours a week, all. One person to go for an oral biopsy every week. That's how
Oh,
much oral cancer there is. That
it's out of
absolutely
control.
does
Yeah.
not happen.
Well,
Doesn't happen.
in diabetes,
Diabetes.
and definitely heart disease. Looks like your computer froze, Shirley. Is it your internet? Well, I'll keep going. What I'm seeing is the when we have
Kind of an
situation.
entity, we can talk about the Colorado model where there are independent dental hygienists. And those dental hygienists are not very many. Hygienists like being an employee because they get protection. If you find that you can tolerate the low bar that occurs in these dental practices, that's great. Otherwise, no, you know,
Well,
otherwise you should start a practice.
okay, here's another issue, Shirley. If these dental practices are investing 10 to $20,000, sometimes 30, with a consultant to come in and organize
Oh,
their
yeah.
business, it seems to me from my conversations with these consultants, it's the same business model over and over and over and over, systems that were 25 to 30 years ago. This is 2025.
Yep.
We are shifting into a higher awareness of patient groups who are Dr. Google, and they want information, they want guidance, and they want to be well. And they don't want lower quality of life. They want a higher quality of life. Now, I get it. There's the people out there say, if it ain't broke, don't fix it. I'm good. And this one dentist in Japan, and this is what's exciting because I believe there's going to be global influence, and the identity of the dental office was going to change the model, and the dentist identity will change because there's three types of dentists, he said. So there's three types of dental practices: the bacteria dentist and the expanding dentist, which, okay, they're expanding in their education, but still staying in that safe zone. And then the third type of dentist, he said, is dental physician. Now, therein lies our transition. Therein lies that they're going to expect the dental hygiene department to grow with them in a partnership. And I said to this consultant I was speaking with, how many dentist office right now in what, there's 170,000, 180,000 in the United States, maybe. He said, what's a percentage of the dental physician mindset? We came out with 1%. 1%. Can you believe that, Shirley? 1%.
Crazy. I'm having connectivity issues over here, so I don't know what's happening. But just keep going because you
Okay.
keep on keeping on, even though it looks like I'm
Okay.
dropping
Yeah,
out.
you look a little frozen now and then. Well, 1%. Now that's almost kind of exciting because that means there's room to grow. That means that there's room to change in the schools. The schools need to change. The schools need to really change their their training techniques and their training and say that you're treating, you're a part of the body. In Europe, dentists are educated as medical doctors and then they specialize in dentistry. That to me should be the bar. Everybody going into healthcare, and same with dental hygiene, go into what we call the physician or the medical grade and then specialize in that part of the body. Now we're all on the same page. There's no medical doctor and dentist hierarchy. I think what gets in, and over the weekend, you said I had a busy weekend. I was with chiropractors teaching them about occlusion. They had no clue about. And when they understood it, they were
Yeah.
very excited to collaborate with dental offices. You couldn't stop them. They were so excited to see the vision. These were young chiropractors who
Hmm.
were very open-minded and wanted to help with the cause. And Dr. Whitmer, Dr. Whitcomb, Dr. Paul was training them, and we all were looking at the cases, and every one of those cases that improved had a dental issue that broke them down. Every one of them had either orthodontics, they had, like Dr. Fonder says, vertical dimension. They were chewing on one side of the mouth versus the other. They were swallowing wrong. Their tongue deviation, they had poor airway. And every thermal image I took of the head and neck had neck strain, neck stress in the neck, like you wouldn't believe. Yeah, well, that's going to affect their shoulders, their walk, their hips, their knees, their ankles. And one lady came in with a walker. He didn't really adjust her neck, but he did pressure points on bilateral of the neck. She got up, she starts walking normal without her walker. And I asked her, I said, have you had dentistry? And she said, I had bad dentistry done and it changed my bite. Well, changing that occlusion is going to change the neural receptors in the brain. It's going to throw off her CNS or central nervous system to give her an imbalance, and also her proprioceptors, her trigeminal nerve. I mean, it all correlates. Why aren't these dental practices seeing the correlation and the collaboration that they might be contributing to neurological breakdown because of their lack of symmetry working in the occlusion with the chiropractor? You need a team. It's apparent. And I think what the weekend showed me in thermal imaging before and after, that the chiropractors realize they can't work by themselves anymore. They've got to work with the dental office that gets it
They
though.
have to, yes, they have to work within a kaleidoscope of care. I think that's probably the word of the year for me this year. I even learned how to spell it. I mean,
Okay, how do you spell it, Shirley?
Kale, like kale, and then an I, and then a doscope. So that's how I I
That's
remember. I'm
great.
like, kale? Why would there be kale in there? But that's how you started out. So kaleidoscope of
Good
care.
job.
And so that's really how to, but then how do you find somebody to work with like that? That is a really, really big question. I've called dozens of chiropractors to see if we could work together just on soft tissue because they really rarely mess with the soft
Well,
tissue and
Shirley,
they don't know what we're talking about.
I think what we need to do in our podcast is start inviting our chiropractors and our dentists so
Yep.
we have them speaking with each other and collaboration conversations. How about we call it kaleidoscope conversation, Shirley? And this way we can have a team approach. Kaleidoscope conversations, because
Yeah.
kaleidoscope conversations in upstream intelligence, meaning we are going to plant the seeds of opening the doors of collaboration. And that's where our consulting comes into play. I've been working in a kaleidoscope environment now since I had to leave the clinical environment. I've been working in a non-clinical environment in a kaleidoscope, and there's a lot of pioneering that needs to be done, and a lot. In fact, I'll tell you right now, nobody includes the dental practice in these wellness clinics. Not one.
I know.
Not one. I've
Not
been in
one.
probably about 15 wellness clinics since I've been here in Las Vegas. Not one of them includes a dental office for their
Not
whole.
even a dental office, just have a dental exam
Well,
and
they're
just
not
at
even
least
including
look.
that. They're all they're doing is saying, come to our wellness clinic. sit in these machines and equipment and get your care. And then when I start working there and taking their thermography images and seeing the amount of dental problems that they have, not just teeth. People think dental is teeth. Dental is kaleidoscope of functioning, myofunctional, and the neurology. Dentistry is neurology. You have nerves inside teeth that are contributing to the pulsation of the organs in the body and the brain that they're totally oblivious to. They just think the tooth just has a little bit of circulation. I'm sorry, but look at the tooth and the correlation and I can see it in the scans, in these full body scans. I see teeth that are leaking infections. They're active infected areas going into the lymphatics, draining into breast tissue. Isolated breast tissue, they're going to chop off that breast and it's the tooth.
It's the tooth. So it looks like I'm frozen again.
No, I can see
I
you.
don't,
You're talking.
okay, good. It's so, I don't know why it's happening. I use this computer at this location a lot for
Well,
video calls. So I'm at home today because I have to run out of here for another appointment. So
but you know
I
what I'm talking about,
oh
Shirley.
yeah. Oh, for
We
sure.
teaming
So
up. I think
yesterday,
what the future is going to
yesterday,
be, yes,
yeah.
it's we're going to pioneer this because I see that it's not happening, and it needs to happen, and it will happen based on our podcast starting the conversation Upstream Intelligence, get the doctors speaking with each other and seeing we need this. That my site, I started drlinks.com and it's linxs.com. And that means that we're going to have this open dialogue of communication and kaleidoscope um, uh, community started because dentists have been isolated from medicine. How many times have I spoken with a medical doctor who says, I don't know anything about the mouth? Really, you don't. So let me just show you that 50% of the cranial nerves are going into the brain and you don't know anything about the mouth. So where's the disconnect? I believe is in the education, the schools. We separate. We're pre-med, pre-dent, pre-nurse, pre-dental hygiene for the first 2 years together. And then we all separate. Never the twain shall meet again or even have a conversation, right? And this has been an ongoing problem that I've seen over and over and over repeated. And I really feel strongly that the business model, it's time for a change and it's time for collaboration, a kaleidoscope business model, right?
Yeah, no, I agree with that 100%. And in my little hospital, my pre-hospital idea, I really think that all of these people should be in one location. Patients right now are just like, oh, I just heard about this. Let's go try that. I just heard about vision therapy. Let me go try that. I just learned about myofunctional therapy. Maybe I should try that. Maybe I should try dowsing. Maybe I should try, you know, maybe red light therapy or maybe blue light therapy. Or now I just learned about violet light therapy. And so
Right.
now we've got all of this stuff and they don't know what to do. They're just trying to get some relief. And by going upstream and getting to, the upstream is up and root cause is down, either one of those has to be explored. And you need to go back and back and back. Yesterday, I did a new patient exam on a young woman, 33, I think, and she can't stay asleep. And so I was looking at the pictures that I took, and what I didn't realize, right, as I was speaking with her, she had four premolars removed, four braces. So her teeth were very straight. There is absolutely no room in her palate for her tongue to be. So she was suffocating every night, all night long, because the bulk of her tongue was in her airway. So that's triggering all of these cranial nerves that you're talking about. Her neck was sticking out like that. And I was like, well, that should be the sign of teeth removal already. I'm going to try that idea. And not, I have no idea what that did to the neurology when they
Well,
took
surely
those
when are
teeth
you going to
out
start?
when she
When you
was
get
12 or 13.
you got to get an infrared camera. Get an infrared camera
Yeah.
and start looking at where the stresses are in her swallowing. You'll see it. It's a glass house. I can't imagine. I can't imagine, really. I can't imagine not having infrared anymore. I mean, now that it's opened up my world, and it was opened up not by a dental office, it was a chiropractor. She
Oh,
heard
there you
about
go.
my radiation poisoning problem and she said, go into thermography. I didn't even know what it was. And once I saw the applications of it and I saw how it wasn't being utilized in dentistry like it should be, then it wasn't being utilized with the structure of the chiropractic care with the dentistry. There's a whole huge void there that is being filled now by the work that we're talking about. But that patient you're talking about, you would see, the lateral, you'd see
Yeah, what would I see? Why
you
don't
would
you
see the
can you
lateral
kind of
to the
describe it?
screen and her neck. Is she forward? Is she, and they start to get that old lady hump, especially with the tech neck. They're leaning forward with their cell phone. And now you've got the stress on the what we call the vagal nerves, which is part of the lung and the breathing neurology. So if those vagal nerves aren't being circulated properly or stimulated, she's not in parasympathetic, she's in sympathetic. So she's shutting down her airway when she sleeps at night, and her body's running from a bear. She's in fight mode, and
Yep,
she won't get oxygen. It's going to go to where her vitals are, and she's going to have limited supply in her blood. She's going to have a lot of health issues when she's aging. And I think what I see the future is people want to age slowly and gracefully. Look at all these Hollywood people. They're so Botoxed and they're so, they don't want
yeah,
to look older. And so
no,
the people that look the youngest to me are the ones that do nothing, but they have parasympathetic lifestyle. They have oxygen circulating in their body. Their nervous system is working just fine, and they have all their teeth. It's the ones that start losing their teeth and putting in these implants that are there's not compatible with the chewing and the neck and the strain on the neck. The thermal images shows you where those stresses are, where the leakages are in the bone grafts. It shows where the leakages are in the sinuses. It shows what doesn't it show? There's probably 2 pages of what thermal imaging and the status and the conditions in the body it shows. It's very well used in Europe, but we're 20 years behind Europe. So we really, with the internet now, why are we so behind? Why aren't we implementing these tools? And why aren't dental hygienists? I'm going to tell you right now, to talk to somebody who doesn't know a tooth number is like pulling teeth. They get confused. It's deer in the headlights. They don't know
yeah.
orientation whatsoever. They don't know tongue. They don't know swallowing. They don't understand the curvature. And you're right. I've
Or
seen
who cares? They don't know why it matters. People are eating and people are talking, so what the hell, they're not exploring the root cause. So this young woman is going to therapy. She's on anti whatever anxiety medications.
I was
she
just,
had a she
yep,
had an anxiety attack that was
yeah,
so intense she had to go to the hospital on account of it. She's
sad.
a broken person.
Yep,
She's 33. What
yep.
is the rest of her life going to be like?
Oh,
So now our
and
question
relationships.
was having
Yeah.
a dental hygiene program that's separate from dentistry. So we're not going to be able to change all the laws in the state in order for hygienists to have their own practice as a hygienist. So you have your own practice as thermography. I have my own practice as myofunctional therapy, even though we have a dental hygiene degree and a license in dental hygiene. So we have parameters that we have to operate within, but it just comes naturally to us anyway. So it's not that big of a deal. So what are we supposed to do with all of these hygienists that have these intense motivations and they are in a dental practice? Is there How do you make it so, do you know, maybe it's just an open
I'll
discussion,
tell
maybe we
you.
should have a
Eh,
business person
eh,
on how to make that happen.
well, I will tell you. It's like
Do it.
religion. I mean, are you gonna, if you, it's a belief system. If you work with someone that doesn't believe in what your vision and insight is for caring of the patient, there's a disconnect. How many dental hygienists want to go into that realm of dental physician care, but they're pushback? I would, now that I
Yeah.
understand about the three types of dentistry, or dentist, I should say, or dentistry, I don't belong in the bacteria. I don't belong in the expanding. I belong in the dental physician realm. I'm going to look for a dental physician to work with. And let me tell you, right now it's hard. It's like a needle in the haystack, but it doesn't mean it will always stay that way, because we went to that conference, that IOMT, and the dentist that came out of a conference or a seminar presentation, the speaker was educating the dentists, in that the biological dentists, about becoming dental physicians. They were so ramped up. They wanted to go into that area, but there was no instruction. There's no guidance. There's no, there were no classes or courses or certifications. They'll fall back into their biological, I call it expanding dentistry mode. And so a dental hygienist almost has to be friends with the dentist and saying, let's explore this in partnership. That's the only way it's going to make a difference. Otherwise, you're going to need to quit that practice that has a bacterial mindset. And I've taught dental hygienists and trained them in this dental environment, and you won't get anywhere. I'm going to tell you, the fear of the dentist in a bacterial setting, they fear change and they fear loss of income like crazy, and they won't let any new ideas infiltrate into their business model, because they are ABC, 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 and that is it. And they don't have any desire to make a change. That dental hygienist needs to get the heck out of there and find somebody else. That's why we work with Dr. Links. We're going to put dental and a kaleidoscope of people that want to find each other in a directory, so that they can work in that
Right.
environment
There you
and
go.
have that support. Right now, how many times have I been told, as a clinical dental hygienist when I was practicing, Victoria, it's nice that you want to help them, but don't talk about oral systemic links because you're scaring the patients. Just clean the teeth. And maybe it was one patient that complained, but the other ones were excited. They're like, thank you so much. I appreciate the knowledge and information. And the dentist said, I could lose my license if you keep talking about these medical conditions that you see in the mouth. So I really came to I had to quit. So I'll tell you, it was hard finding, and it was challenging finding a dental practice that just kind of left me alone and let me speak with the patients. And I had a following. And as long as I had people coming in and he saw things to fix, he was good to go. But your question is going to be in stages and phases, I believe, for a hygienist to evolve, our profession to evolve into the dental physician partnership. It's too bad Colorado didn't go in that route. Be owning a business is not easy. It's not easy.
You're right. And the driver for that time was back in 1986. I think it was the year that I graduated from dental hygiene school. The dentists were blocking hygienists from working in long-term care facilities.
Oh,
They couldn't go in and brush these people's teeth
oh,
even.
how
And
sad.
so the legislators got a hold of that and they were like, yeah, no, they're going to just work on their own then. Screw you. So, I don't want to have a win from a screw you because
Hmm. Any kind
it's
of
not as
confusion.
beneficial. Yeah.
Hmm.
So we need to kind of get together. Hygienists need to know how to write a proposal for their employer dentist where they take one piece of all of this stuff that we're talking about and develop that with their dentist team person as a licensed professional. They have to give up some things, like maybe the dental assistant can, polish and floss the person's teeth. They don't have to be there for that. And then then the dentist has to say, that's not working for me. Write a proposal that is a counter proposal so that they can work it all out. It's got to be a really high level of communication. I think on our list of people to interview, I think we should also have a a consultant that works that way, that helps dental practices develop a dental hygiene practice within that isn't only resting on periodontal treatment.
Well, what it is education. What
Yep.
I've seen is when these conferences happen and you have a speaker from, say, another country that has a working business model and discusses this type of business working model here in the United States, right away, the ones that are motivated, usually the dentists in their 30s and 40s, age bracket, are excited. A lot of them are from other countries that came here, and integrative models aren't a new concept to them. It's common sense, actually. And I see these practices starting to integrate medical and dental clinics, or they call them dental medical clinics, that they're starting to spring up, just a few of them, and they have a dental and a medical. Even one of them, I thought this would be great to go in and show them infrared imaging and show them how to put it together. They even had an infrared imaging person there full time. They just didn't have my software, which is Dr. Link's software that shows how to pull the
It brings it all
information
together. Yeah.
and put it all together. And you know who had the pushback? Was the front office manager. They didn't understand how this was going to increase their income. They didn't understand where the protection was. They could get sued if they're looking for diabetes in the mouth. He got so scared of the protection and the lawsuits that could happen after discovering health issues using an infrared technology only on the head and neck. She was doing full body. She had a whole image, her whole practice in a dental medical clinic, but never the twain shall meet. The medical doctors were doing their thing on one side end and the dentists were doing the other. And I said, well, where's the connection? And they didn't have a system in place. I don't see systems in place. I see lots of people coming in and they're trying to look just to watch,
Yeah.
but there's no,
It
we
has to
haven't
be
yet seen a
developed.
working
Yep.
business model. And when there is something that's similar, like what Pacific Dental Services is doing with Stephen Thorpe, he's got dental medical software. It's over and it's incumbency and it's a lot of data intake, and he's forward thinking. He sees the potential of it. It would be nice to meet him in person. I hear he's super busy and unable to have meetings with, but what I'm seeing is the conversation starting. And will he in the future do anything about it to educate the masses about how to educate and and get the fear out, because the schools teach you how to isolate and segment your care. Then you get out in an
Hmm.
environment where it says integrate the care, and they lost their footing. And the
Yeah.
insurance companies aren't teaching how integration, they're calling it cross code billing. Okay, so we have some medical codes inside dental and dental codes inside medical offices, but there's still no consultants showing them how to use it, very few. I think this is a whole area that's pioneering right now as we speak. So that's what my 2 cents is worth. But I really believe they're going to have a communication tool like the software I designed to utilize and rethink the model of how dentistry is implemented. Because if you think about it, the last place people want to go is to the dentist. They'll go to the dental hygienist because they want the teeth cleaned and they want a whiter teeth smile, and maybe better breath. That motivates them to go, but they don't want to see a dentist. Nobody wants to see a dentist. It's like bad news. So how do you get the dentist with good news and the dental hygienist together with a more positive a positive environment? That's why when I 15 years ago I worked with a dentist in Santa Barbara. We had Santa Barbara Dental Spa. We
Hmm.
designed, people walked in. I didn't know at the time how powerful this tool is that we work with, but we had a massage therapist there. We had a medical doctor in the office. We had a dentist and a dental hygienist. I was the dental hygienist. It looked like a spa. We had candles burning. We had incense. It was very, very nice. But there were no systems that I designed or knew what I was doing. I just said it's a good idea, and the dentist was from India and he thought it was a great idea, and he took on the risk of the financial investment. And to this day, it's still there. But the massage therapist left, the medical doctor left, And I think he's just now practicing just dentistry with other assistants, dental, but it was a good start, a good idea
You
to,
got to start somewhere. That's exactly right.
it was the lack of
I,
systems. So you're asking about a consultant? Well, right now there isn't one that exists that I know of.
yeah,
We're
no.
it. You and
Well,
I think
it's
we're
the
the
business
consultants.
part, right? You need to have a business mind. And even though you have a business mind and I have a business mind, we it's not the same as somebody that's working with dental businesses on on the regular. I haven't worked in a dental practice in, I don't know, a long time. You have a lot of contacts within dental businesses, but I feel like we're always missing a little bit of something. So, having somebody to talk to on this podcast, I think might be really helpful to get
Oh
people to
yeah.
understand how powerful your software can be in putting all of these components together, and then what a dental hygienist can really do, because it's not just about white teeth. It's about it's about developing a face and developing an airway that won't succumb to sleep apnea, and developing dentition and occlusion that doesn't lend itself towards orthodontic treatment. I'm not saying that we don't need orthodontists, we're always going to need them, but we want to prevent dental decay. We want to prevent TM joint problems.
But
And
now listen to what you're saying, Shirley.
yeah,
That's average allopathic type thinking. We want to prevent cavities. We want to prevent TMJ.
yep,
That's typical dental chit chat from, 1940.
that's what
But
I'm saying.
and
There's
really,
more to it.
that
There's
their
more to what
dental
a hygienist
decay.
can be
Well,
doing.
yeah, your teeth are communicators and your eyes are communicators. That's like saying when your eye whites are yellow, give you eye drops. It's connected with your liver and your teeth are connected, like this Japanese dentist
Yep,
wrote about teeth are organs. He's really saying, like you said, in embryo state, in conception of the fetus, the teeth are being formed first in the neurological sense, and then the neural crest, which is the fluid, and then the brain tissue. So teeth really have an integral part in the communication system where dentistry hasn't had its roots put in yet. Dr. A.C. Fonder, his book will explain it all. That should be a Bible in every dental practice to understand where their identity is. Once they understand that you're working in an environment that's affecting the entire body, how I mean that's a holy area that you want to make sure you don't mess up, and you won't if you have the knowledge, collecting it, investigation, with your team. You have to have a team. I see this over and over,
yeah,
with dental practices not understanding that they should have a chiropractor and a medical doctor, a myofunctional therapist. They need to have a team in place, a massage therapist, but not when I say these labels loosely, because they all have their specialties involved in the circulation of the body that enhances the neurology in the brain. Which people want to age slowly? Back to what we were saying, aging is a big part of neurological issues in the young generation now. The younger generation is losing neurological circulation faster than any time I've ever seen it. Haven't you, Shirley? I mean, it's crazy.
the kind of kids that we're seeing right now are just not, there's just so much going on all the time. Let's kind of wrap up. We're kind of at the end of our time here. And so I want to kind of help people understand, what is a solution. So we talked about education being a solution, but that takes forever, and we don't want to wait that long. And just, I guess the solution right now is to work with the two of us to kind of help
Mhm.
build a dental hygiene model, in a dental office and a medical office and a chiropractic office. There's no reason why a chiropractor cannot have a dental hygienist working there so long as she's not brushing people's teeth.
Well, there's an organization called PWAI, and they offer license to touch. and they work specifically with integrative providers in other areas of scope of practice. So if you're a dental hygienist and you want to work in a wellness clinic, you would work with their licensing. And it's very well thought out. They've been in business 20 years. It's PWAI, and it would even have a dentist that was semi-retired and wanted to work with a chiropractor, and evaluation. And evaluation is a big part of integrative health. So the solution is um, basically a cliffhanger until we get people talking about it when our next podcast. I mean, we are setting the stage and planting the seeds of this is a need. It's not going away. There's going to be more younger generations that with ADD, and now they're labeling autoimmune systems with POTS. They don't know how to help people unless they put drugs in their body, in their systems. And the anxiety attacks is because of her brain waves not having what she needs structural wise. That could be helped with the chiropractor and the dental environment together in synergy in the kaleidoscope of care. And then add the microscope. What kind of bacterial load does she have? That's contributing to the load on her brain and her immune system. So Shirley, dental hygienists, we're just this is the tip of the iceberg, in my opinion.
We're underutilized by far,
So
by
the
far.
solution is open the door and
Yeah.
network. I think network and start
And
speaking about it.
professional curiosity.
Yes,
Launch your professional
amen.
curiosity. How could it work in your
Your
practice?
practice.
How could I incorporate that into my practice? So that's what I think our number one thing is. But in order to get in touch with me, people can go to primalair.com, and I've got all my digits there. And then for you,
It would be Dr. Links, DRLINXS, drlinks.com, and I'm available on the contact. More than happy to help in any way. I think Shirley and I are working on a new business model so that we will be hired as a team to go in and help set up your dental hygiene department and your dental industry. And we also have business advisors working with us now. So it's not just your dental hygiene department, but your front office as well with your insurance codes. So don't be too scared that you have to take only cash, but you probably might be, if you're listening to us, a cash only practice. But I will tell you, it's not going away. People want it.
thank you, everyone. Please leave your comments and suggestions for other topics, or if you feel like you have to yell at us, we're okay with that.
We're fine with that.
Um, because
We're
we're
used to
in new ground. We're in
it.
new ground, and that's what happens, right?
Yeah.
So I'm sorry, my computer's been just such a pain in the neck today, and
You look good in frozen faces, Shirley.
it's it's like, okay, what face did I just have? All right, thanks, Victoria. See you
All
next
right,
week.
Shirley.